This is the Emergency Medical Minute.
Okay, super friends. So we do a lot of CTs here, right? Including for our stroke patients. And what's the question you always get from radiology when we're about to do a CT with contrast? Yeah. What is the creatinine? Are we going to give people renal failure if they get contrast, right? And it turns out that in the past, when we had kind of the initial kind of starting contrast, which were really hyperosmotic and really kind of nasty for the kidney, those might have had some justification of what the heck is the creatinine, because we might give them renal failure. But what we're using nowadays is not your grandma's contrast, so it's actually pretty safe. And there's a large meta-analysis where they looked at basically 100,000 patients that got contrast over 28 different studies, and this was done in the Annals of Emergency Medicine in January. And what was the conclusion? It doesn't matter. It don't matter, exactly. So one, that contrast given in your IV, especially even if people have a little bit of increased creatinine, it doesn't really increase patients' chance of developing renal failure. Kind of a lot of that is more due to whether a patient's really sick or not, whether they have sepsis or not, whether they have all these other things, and they're going to develop kidney injury anyways. But the bad player in this might not be the contrast that you're giving. So whether that's enough to really move our practice, questionable, but I mean, it definitely makes me think that the science is starting to move in the direction that it's a lot safer to give contrast even in some of those patients who's kind of questionable, especially when you have a large study like this that says it's safe. So contrast, maybe not that bad for your kidneys.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.